Have you looked at your feet today? Not because they hurt, not because you're checking for a blister, but because they may be trying to tell you something your blood tests haven't revealed yet. What if I told you that some of the earliest warning signs of diabetes don't appear in your blood sugar readings? They appear in your feet, sometimes years before a diagnosis. Most people think diabetes announces itself with constant thirst, frequent urination, or unexplained weight loss. Sometimes it does, but many people develop diabetes quietly. The damage begins long before obvious symptoms appear, affecting the smallest blood vessels and nerves in the body first. And because your feet are the farthest part of your body from your heart, they're often where those silent changes show up first. Let me tell you about someone I'll call James. James was a 68-year-old retired school principal who came to see me for a routine heart evaluation. He exercised a few times a week, enjoyed gardening, and insisted he felt perfectly healthy. As we finished his appointment, he casually mentioned something that almost didn't seem worth bringing up. "Doctor," he said, "my toes have been feeling a little numb lately. Probably just old age." He laughed. His wife didn't. She said she'd noticed he kept rubbing his feet every evening while watching television. That small comment changed everything. I ordered a few additional blood tests, including a fasting glucose level and a hemoglobin A1C. The results were surprising. James wasn't just developing diabetes. He had likely been living with type 2 diabetes for years without realizing it. His feet had recognized the problem long before he did. Stories like James's are more common than most people imagine. As a cardiologist, I've learned that diabetes isn't simply a disease of high blood sugar. It's a disease that quietly injures blood vessels and nerves throughout the body. Your heart, kidneys, eyes, brain, and especially your feet all depend on healthy circulation. When blood sugar stays elevated over months or years, those delicate structures begin to suffer. The encouraging news is that your body often sends warning signals early. The challenge is recognizing them before permanent damage occurs. Today we're going to explore 9-foot signs that may suggest hidden diabetes. Some of them are surprisingly subtle. Others are often dismissed as just getting older. Stay with me until the end, because the 9th sign is one of the easiest to notice, yet it's also one of the most overlooked by both patients and their families. Remember, none of these signs alone can diagnose diabetes. They simply tell us that it's time to pay closer attention and, if necessary, speak with your healthcare provider. Let's begin with one of the earliest and most common warning signs. Have you ever noticed your foot falling asleep after sitting in one position for too long? That's completely normal. But what isn't normal is experiencing tingling, numbness, or a pins and needles sensation for no obvious reason. Maybe you're standing in the kitchen preparing dinner, maybe you're lying comfortably in bed, or perhaps you're taking your usual evening walk. Suddenly your toes begin to tingle, you shake your foot, thinking circulation has been cut off. But nothing changes. Why does this happen? Think of your nerves as electrical cables running from your brain all the way to your toes. Each cable is wrapped in a protective coating that allows electrical signals to travel smoothly and accurately. When blood sugar remains high for long periods, it can slowly damage that protective coating. It's similar to what happens when the insulation around an electrical wire begins to wear away. The electricity still flows, but the signals become distorted. Instead of transmitting clear messages, the nerves begin sending confusing sensations, tingling, numbness, or the feeling that you're wearing invisible socks even when you're barefoot. Doctors call this peripheral neuropathy, and it's one of the earliest complications associated with long-standing diabetes. Many people ignore it because the symptoms are mild at first. But mild symptoms often become more noticeable over time if the underlying cause isn't addressed. If you've been experiencing unexplained tingling in your feet for several weeks or months, don't assume it's simply part of aging. A simple blood test could provide valuable answers. And if your blood sugar is normal, you've gained peace of mind. If it isn't, you've given yourself the opportunity to take action before more serious complications develop. Unfortunately, the next warning sign can be even more uncomfortable because it often appears when you're trying to get a good night's sleep. Let's talk about why some people experience burning feet after dark and why that sensation deserves far more attention than most people realize. Now let's move to a symptom that many people dismiss as poor circulation or simply getting older. Have you ever climbed into bed feeling completely comfortable, only to notice that the bottoms of your feet suddenly feel unusually hot, not warm from the blankets, not sweaty, but as if they're slowly burning from the inside out? Many patients describe it differently. Some say it feels like they're walking across hot pavement. Others say it's like wearing heated socks they can't take off. One gentleman told me it felt as though someone had placed a heating pad under his feet every single night. Interestingly, the discomfort often becomes worse after sunset. Why? Because during the day, your brain is busy. You're talking with family, running errands, watching television, or working around the house. At night, when everything becomes quiet, Your brain notices every tiny signal coming from your body, but there's another reason. Damaged nerves don't simply stop working. Sometimes they become overactive. Imagine a smoke detector with a faulty sensor. There's no fire, yet the alarm keeps sounding anyway. That's essentially what happens inside damaged nerves. They begin sending pain or heat signals to the brain even though nothing is actually burning. Doctors often associate this with diabetic peripheral neuropathy, a condition caused by prolonged exposure to elevated blood sugar. The encouraging news is that nerve damage usually develops gradually. The earlier blood sugar is brought under control, the greater the chance of slowing further damage and reducing symptoms. If burning feet become a regular nighttime visitor rather than an occasional annoyance, don't simply buy thicker socks or another foot cream. Ask yourself whether your body might be asking for something much more important. A simple conversation with your healthcare provider and a blood sugar evaluation. Sometimes the symptom isn't really about your feet, it's about your metabolism. And speaking of things that don't seem serious at first, the next sign may look like nothing more than a tiny blister. But for someone living with undiagnosed diabetes, that tiny blister can become a very big problem. Think back to the last time you accidentally nicked your skin. Maybe it happened while trimming your toenails. Maybe a new pair of shoes rubbed against your heel. Normally, your body begins repairing that injury almost immediately. Blood carries oxygen, nutrients, and specialized immune cells directly to the wound. Within several days, healthy skin begins forming again. It's one of the most remarkable repair systems in the human body, but elevated blood sugar quietly interferes with nearly every step of that process. Imagine trying to repair a road after a storm. You have workers ready to help, you have building materials, but every road leading to the construction site is partially blocked. The workers arrive late, the supplies arrive slowly, the repairs take much longer than expected. That's very similar to what happens inside the tiny blood vessels of your feet. Years of elevated glucose can damage these microscopic vessels, reducing the delivery of oxygen and nutrients exactly where they're needed most. At the same time, high blood sugar can weaken the body's ability to fight infection. As a result, even a small blister or scratch may linger for weeks instead of days. This is why healthcare professionals encourage people with diabetes to examine their feet regularly, not because every blister is dangerous, but because unnoticed wounds can gradually become infected before they cause significant pain. One of the challenges is that nerve damage often develops alongside poor circulation. In other words, a person may not even feel the injury that needs attention. That's why a quick foot check after your evening shower can become one of the simplest health habits you ever develop. Look between your toes. Check your heels. Examine the bottoms of your feet if possible. If you notice a wound that's becoming red, swollen, painful, producing drainage, or simply refusing to heal after several days, don't ignore it. Prompt medical attention can prevent much more serious complications later. Your feet are remarkably resilient, but only when they receive the circulation and nerve function they depend on. And that brings us to another warning sign that's often hiding in plain sight. It doesn't hurt, it doesn't burn. In fact, many people never notice it until someone else points it out. In the next section, we'll discuss why changes in your skin color, along with unusually dry and cracked heels, may reveal far more about your blood sugar than you ever expected. Let's move on to something many people blame on cold weather, aging, or simply forgetting to use moisturizer: dry feet. At first glance, it doesn't seem like a medical issue. After all, who hasn't dealt with rough heels from time to time? But when dryness becomes persistent, especially when deep cracks begin forming, it may be telling a much bigger story. One patient, whom I'll call Linda, visited my clinic because she was concerned about her blood pressure. As we talked, she casually mentioned that no matter how much lotion she applied, the skin on her heels kept splitting open. She had tried expensive creams, overnight socks, even home remedies she found online. Nothing seemed to work. When we looked deeper into her health, blood tests revealed something unexpected. Her blood sugar had been elevated for years. The cracked skin wasn't the problem, it was one of the symptoms. So why does diabetes affect the skin? Healthy skin depends on three things: adequate hydration, good circulation, healthy nerves. High blood sugar can interfere with all three. Excess glucose causes the body to lose more fluid through increased urination, making dehydration more likely. At the same time, damage to the tiny nerves in your feet may reduce normal sweating. Sweat isn't just something your body produces to cool itself. It also keeps your skin naturally moisturized and flexible. Without enough moisture, the skin becomes dry, loses elasticity, and eventually begins to crack. Imagine bending a brand new leather belt. It flexes easily. Now imagine bending one that's been left in the sun for years. Instead of bending smoothly, it begins to split. Your skin behaves much the same way. Those cracks may seem minor, but they create tiny openings where bacteria can enter. For someone with reduced circulation or diabetes, even a small crack can become the starting point for a more serious infection. That's why healthy foot care isn't about appearance. It's about protection. If your heels remain dry despite good skincare, especially if it's accompanied by other symptoms we've discussed today, it may be worth asking your healthcare provider whether a simple diabetes screening is appropriate. Now, while cracked skin is something you can see, the next sign is something many people don't notice until it begins affecting their daily life. Have you ever reached into bed and noticed your feet felt like blocks of ice? Maybe your spouse has even joked that your feet could cool down the entire mattress. Cold feet are common, especially during winter. But if your feet constantly feel cold, even when the rest of your body feels comfortable, it deserves attention. Your feet rely on thousands of tiny blood vessels to deliver oxygen and nutrients every second of the day. Think of these blood vessels as a network of highways. When traffic flows freely, every neighborhood receives the supplies it needs. But when the roads become narrowed or damaged, deliveries slow down. Some neighborhoods begin running short. That's very similar to what prolonged high blood sugar can do. Over time, elevated glucose damages the inner lining of blood vessels. The vessels become less flexible, circulation becomes less efficient, and the tissues farthest from the heart, especially your feet, may not receive the blood flow they need. As a cardiologist, this is something I pay close attention to because circulation problems don't only affect the feet, they may also signal changes occurring throughout the cardiovascular system. Sometimes cold feet are caused by harmless factors like room temperature or sitting still for long periods. But when they're accompanied by numbness, slow healing wounds, burning sensations, or skin changes, they deserve a closer look. Here's a simple observation you can make at home. Place the back of one hand on your shin, then on the top of your foot. Do they feel dramatically different in temperature? If one foot consistently feels much colder than the other, or if both remain unusually cold despite warm surroundings, it's worth mentioning during your next medical visit. Your doctor may evaluate circulation, nerve function, blood pressure, and blood sugar together, rather than looking at only one symptom in isolation. Because that's an important lesson many people miss. Your body rarely sends just one warning sign. It usually sends several. The challenge is recognizing the pattern before serious complications develop. And speaking of patterns, the next sign is one that many people never feel at all. They only discover it when they notice mysterious marks on their socks or when a family member points out something unusual about their feet. In the next section, we'll discuss changes in skin color, swelling, and why your feet may quietly reveal problems long before you feel pain. Now let's talk about a warning sign that many people don't notice until someone else points it out. Have you ever looked closely at the skin on your feet or around your ankles and thought, I don't remember my skin looking like that? Maybe you've noticed darker patches, a reddish tint that doesn't fade, or skin that suddenly looks unusually pale compared to the rest of your leg. Many people assume these are simply age spots or poor circulation. Sometimes they are, but sometimes they're clues that your blood vessels are under stress. Think about your skin as a window. It often reflects what's happening beneath the surface. Healthy skin depends on healthy circulation. Every second, oxygen-rich blood travels through thousands of tiny vessels, nourishing the skin and carrying away waste products. When diabetes damages these microscopic blood vessels, that delicate balance begins to change. Some areas may receive less oxygen, others may develop inflammation. Over time, the color and texture of the skin can gradually change. You might notice brown discoloration around the ankles, shiny, thin skin that almost looks polished, or patches that seem darker than they were a few years ago. None of these changes automatically mean diabetes, but when they're combined with numbness, burning, or slow-healing wounds, they paint a much clearer picture. One patient I'll call Robert came to see me because of mild swelling in his legs. During his examination, I noticed the skin around his ankles had become unusually shiny and discolored. He assumed it was simply aging. Blood tests later revealed long-standing type 2 diabetes that had never been diagnosed. The skin had been telling the story long before his blood work confirmed it. This is why I encourage patients to do something very simple. Once a week, look at your feet in good lighting. Notice the color. Compare one foot with the other. Ask yourself, has anything changed recently? Our bodies often whisper before they shout. Learning to recognize those whispers can make all the difference. Now let's discuss something that affects millions of older adults: swollen feet. After standing all day, mild swelling can be perfectly normal. Gravity pulls fluid downward. Your shoes feel tighter, you elevate your feet, the swelling improves. That's expected. What isn't expected is swelling that keeps returning day after day, or swelling that's present even after a full night's sleep. Here's why. Imagine your bloodstream as a carefully balanced river. Fluid constantly moves between your blood vessels and your tissues. Healthy blood vessels keep that balance under control, but diabetes can gradually damage the vessel walls, making them less efficient. Fluid begins leaking into surrounding tissues more easily. At the same time, diabetes increases the risk of heart disease and kidney disease, two conditions that can also contribute to persistent swelling. As a cardiologist, swollen feet always make me pause, not because swelling automatically means something serious, but because it's one piece of a much larger puzzle. I've seen patients who believe they simply needed compression socks. Instead, further testing uncovered uncontrolled diabetes along with early heart disease. The feet weren't causing the problem. They were revealing it. Another important point is that swelling can reduce blood flow to the skin. When tissues stretch, circulation becomes less efficient. That makes it harder for small cuts or blisters to heal. It's another example of how multiple symptoms often work together rather than appearing alone. If swelling is accompanied by shortness of breath, chest discomfort, sudden weight gain, or swelling in only one leg, seek medical attention promptly. Those symptoms deserve immediate evaluation. But even if swelling seems mild, don't ignore it if it becomes part of your daily life. Your feet may be asking for a closer look at your overall health, not just your circulation. Now we've covered 7 warning signs. The next one is particularly concerning because many people don't realize it's happening until someone else notices. Ironically, the problem isn't that your feet hurt, it's that they don't hurt at all. And sometimes that's even more dangerous. In the next section, we'll discuss why losing sensation in your feet may be one of the strongest warning signs of hidden diabetes, and the final sign that many people overlook until it's too late. Now let's talk about one of the most dangerous signs of hidden diabetes. Ironically, it's not pain. It's the absence of pain. Imagine walking barefoot across your kitchen floor. You accidentally step on a small piece of gravel. A healthy nervous system immediately sends a message to your brain. Ouch! You lift your foot instantly. That pain protects you. It's one of the body's most valuable defense systems, but diabetes can gradually damage those protective nerve pathways. Instead of sending a loud warning signal, the nerves become quieter and quieter until important messages never reach the brain at all. I've met patients who discovered a thumbtack in their shoe only after taking it off at the end of the day. Others found a blister during a shower without remembering anything that caused it. One gentleman came into clinic wearing brand new shoes. When he removed them, there was dried blood inside. He had no idea he had developed a large blister while walking. He simply couldn't feel it. That's the hidden danger of diabetic neuropathy. Pain disappears, but injuries continue. Think of pain as the dashboard warning light in your car. If the warning light stops working, the engine doesn't suddenly become healthier. It simply means you no longer know when something is wrong. Your feet work the same way. When sensation decreases, everyday activities become much riskier. A pebble inside your shoe, a sock that's folded awkwardly, a blister from a long walk, these small problems can go unnoticed for hours or even days. That's why people living with diabetes are often encouraged to inspect their feet every evening. Not because every injury is serious, but because finding it early makes treatment much easier. A simple habit can make a remarkable difference. Before bed, remove your socks. Look at the tops of your feet. Check between your toes. Examine your heels. If you can't easily see the bottom of your feet, use a hand mirror or ask a family member to help. It takes less than 1 minute, yet it may help prevent problems that become much harder to treat later. And now we've reached the final sign. It's one almost everyone overlooks. Not because it's rare, but because it seems too ordinary to matter. Sign number 9. Your toenails keep changing. When was the last time you actually looked at your toenails? Most people trim them, put their shoes back on, and never think about them again. But your toenails often reveal important clues about your overall health. Healthy nails grow steadily. They remain smooth, firm, and relatively consistent in color. When blood flow begins declining, or blood sugar remains elevated for long periods, nail growth may gradually change. You might notice nails becoming unusually thick, yellow, brittle, or difficult to cut. Some people assume it's simply a fungal infection. Sometimes it is, but diabetes increases the risk of fungal infections because elevated blood sugar creates an environment where certain organisms thrive more easily. Reduced circulation also means your immune system has a harder time reaching these areas. As a result, infections that would normally clear quickly may linger for months. One patient I'll call Helen delayed mentioning her thickened toenails because she thought it was purely cosmetic. During her annual examination, we discovered she also had elevated blood sugar and early nerve changes. Treating the underlying diabetes became just as important as treating the nails themselves. Again, no single symptom proves diabetes, but patterns matter. Thick nails, numb toes, burning feet, slow healing cuts, persistent dryness, cold feet, color changes, swelling. Each symptom is like a single puzzle piece. One piece tells you very little. Put them together, and the picture becomes much clearer. If today's video leaves you remembering only one thing, let it be this. Your feet are not separate from the rest of your body. They are connected to your heart, your kidneys, your eyes, your brain. Every tiny blood vessel in your feet reflects what's happening throughout your entire circulation. Diabetes doesn't suddenly appear overnight. For many people, it develops silently over years. Long before serious complications occur, long before vision changes, long before kidney disease, Long before heart attacks, the body often whispers. The question is whether we're listening. The encouraging news is that early detection changes everything. Simple blood tests such as a fasting glucose level or hemoglobin A1C can often identify diabetes or prediabetes before major complications develop. And when combined with healthy eating, regular physical activity, maintaining a healthy weight, quality sleep, and appropriate medical care, many people significantly improve their long-term health. Remember, this video isn't meant to create fear. It's meant to create awareness. Because awareness leads to action, and action protects your future. Tonight, take just 1 minute. Remove your shoes. Look carefully at your feet, not with worry, but with curiosity. Your body may be telling you something important. If you noticed one or more of these signs, don't panic. Simply schedule a conversation with your healthcare provider. Sometimes the greatest act of prevention begins with one simple question. Could these changes mean something more? If you found today's video helpful, let me know in the comments which foot sign surprised you the most. Your experience may help someone else recognize a symptom they've been ignoring. If you enjoy science-backed health information explained in a simple, practical way, don't forget to like, subscribe, and turn on notifications so you never miss another evidence-based health guide. And if you think your feet can reveal hidden diabetes, wait until you discover what your eyes, hands, and even your mouth may reveal about your heart health. We'll explore those surprising warning signs in our next video. Until then, take care of yourself, stay active, and remember, the earlier you recognize the warning signs, the more opportunities you have to protect your health and your future.